Welcome, everybody, to another amazing episode of Wellness Warriors. And today I've got Dr. Lindsey Berkson. She's a breast cancer conqueror, which she's going to share her story. But I personally consulted with her. She's a genius. She has done so much research. She's an integrative nutritionist. She is a gastrointestinal and endocrine specialist since the 1980s, when these sorts of things weren't even talked about. She's a scientist. She's a researcher. And she has an amazing personal story herself that, just the fact that she is able to heal her body after everything that she's been through, and she's functioning, and she looks great, and she's beautiful, and she still helps so many people globally. I'm just thrilled to have her on our show. So thank you for taking the time, Lindsey. Dr. Lindsey, it's great to have you.
Thanks so much. That was a really sweet introduction.
Well,
and it's an honor to be on your show with someone, writing. I consider you a collaborator and a sister of the heart. So,
well, thank you. Thank you. So you have a very interesting story. When I was going through my second healing journey from 2015 through 2018, I did a lot of research, and you were one of the top doctors that I wanted to consult with, and we did, and you were very helpful. You really helped me to understand the benefits of specific hormone therapy while on a healing journey. But let's start off by telling everybody your personal healing journey with cancer and everything that you went through and where you are today.
So when I was young, I was doing everything right. I was eating organically since I heard a lecture on You Are What You Eat when I was 16 and a half years old. And my mother was state champion, one of the very first women in the United States to be state champion, a true athlete. Wow. So I was raised to get up off the couch and exercise every day. And I got into yoga early on, so I was doing silence and forgiveness and detox. I worked with Dr. Bernard Jensen at the Hidden Valley Health Ranch, and we'd go out into the surrounding countryside and pick chaparral and sage and make our own detoxification teas that we would use in high colonics. So I was doing all of that which people do today once they're diagnosed to get well. Positivity, much more plant-based diet, exercise, meditation, mindfulness, and I kept getting cancers. I kept growing tumors. None of it made any sense. People would say, if cancer is a call to change something, perhaps you ought to do a mono diet of bonbons. Forget those sprouts.
Right.
And it was really a perplexity, although I'm always of the ilk that no matter what, I'll still continue to do good. Some people say, well, if nothing's working, I'll just have 5 martinis a day and let myself go to pot because I'm going to pot anyway. But that's not my makeup. But I had read an article in the mid-1990s that as the planet gets more and more polluted, many of these pollutants were going to assault our hormone signals, which are like our physiologic internet system. And our emails would freeze up or go awry, and that was going to start affecting many things like incidence of cancers and even brain function, cognition in kids, ability to want to connect with other people, that it was a big deal, that it was a threat to humanity. These pollutants were threatening our hormones, and our hormones are much more global signalers than people realize. We often just think of them as sexy things, reproductive things, or if you have a hormonally driven cancer, we think of hormones, or older age, but we don't realize that hormones rule your life, your whole life. They rule your brain, your vocal cords, your lungs, your kidneys, your digestive tract. They rule everything. That's why my latest book is called Sexy Brain, because your brain is ruled by sex steroid hormones, estrogen, progesterone, testosterone, and the love hormone, oxytocin. So I decided to write a book on that because that made a lot of sense to me. This is the mid-1990s, and no one had heard of hormone-altering chemicals then. And I spent 6 years working on that book. And while I was doing that, I noticed that laboratory animals exposed to a specific drug that was now considered the most powerful synthetic estrogen hormone altering chemical ever invented, if they were exposed to that in the womb, they got all these different tumors and health conditions, of which I had every single one of those. Every single one. And I
Wow.
went, oh my God, maybe that's an answer of why I was doing everything right, but getting all the wrong outcomes. I lost a kidney, I lost an adrenal gland, I lost my fallopian tubes, my ovaries, my uterus, half my thyroid, one of my parathyroids. I mean, I could go on and on. I kept growing tumors, and a number of them cancer diagnosis. So I wrote away from my mother's birth records at the Michael Reese Hospital in Chicago, where this drug was given to a lot of pregnant women as a prenatal vitamin, because my mother didn't remember. Most mothers didn't remember. And of course, she didn't want to ever think she did something wrong to her daughter. So a lot of the moms were in denial. I didn't do anything to harm you. Nobody wants to think that they would harm their own child, of course. So I got those microfiche films 6 months before they shredded them all, because my mother was so old and I've been in practice over 40 years. So I'm kind of also an elder in society. And I got them. They came in a big manila envelope, and with shaking hands, I kind of tore open the envelope and pulled out the papers and looked. And there it was. My mother had been given injections and pill form of diethylstilbestrol, or DES, in the first trimester, which was given to millions of women for 36 years till 1971. It was banned as a class 1 carcinogen.
Wow.
And daughters born to those women are known as DES daughters. And many of them are prone to get cancers because that DES down-regulates tumor suppressor genes that watch your body, your nooks and crannies when you have a cancer cell, and they help your body pounce on it. Those genes were damaged by that in the womb exposure. So then I decided to sleuth the literature for what might, now that I knew root cause, now I understood that I'm eating right, forgiving everybody, detoxing, but getting cancers. What the heck? Mm-hmm. Now I understood root cause. So I sleuthed the literature for what might upregulate P53 and Wnt7 tumor suppressor genes. And I discovered that there was this protective hormone metabolite that was not utilized very much. And at that time, you could still get it. And just recently, it's become almost impossible to get. But I started it 18 years ago, this specific hormone metabolite. It's a prescription. And I stopped the tumor madness. And just recently, they've stopped access to it. And I called up the FDA, the derm division, and they said, well, there's no monograph on it. And I said, well, I'll write a monograph on it. And they said, well, you have to be a research fellow. So I had to apply to become a research fellow, and I did. But right at that time, I had to deal with another health crisis, because my whole life is a series of health crises that are a consequence of what was epigenetically set up in the womb. And then I get this crisis. I'm told there's no answer over and over and over again for whatever the crisis is. And then I dive into the literature. I figure out what that answer is, and I come out the other end. And I didn't know it was my fate to not only go to school, but to also learn medicine from the inside out. And I have learned that when doctors tell you that there's no answer left for you, with all my heart, I know that that means that they know no answer left for you. It doesn't mean in this big wide world that there isn't out there, or maybe it's outside of the box, which is why I wanted to talk today. I was so excited about some out of the box answers for breast cancer victims. But that's my story in a nutshell.
That's amazing. Now, what's the hormone, if you don't mind my asking, that is no longer available, that has been available? I know I talked to Dr. Roberts about it this morning, and she said, yeah,
right. I lecture for PCCA to pharmacists a lot. I'm lecturing to them in Canada, and just got invited to Australia, and they're very interested in all of this. And you had to get it from a compounding pharmacist. And one of the guys I lecture from just found a source in China, and we had to make sure that it didn't have contaminants, because a lot of Chinese substances have contaminants in them, and it didn't. But he can't ship to Florida because the FDA is making more and more restraints on compounding pharmacies, and one of the restraints is not to ship outside your own state where you don't have a license. And it's crazy to keep up a license to every state that you would normally ship to. Just a few years ago, that was not a law on the books. So We're trying to get a hold of it. I've been on it for almost 18 years, and I just ran out of it about a month ago. And honestly, I'm nervous since I'm doing everything I know to do, but that's been my go ahead and my real protect my back. So I'm working really hard to get this available. It's the final metabolite of estrogen called 2-methoxyestradiol. If you're a healthy methylator, you're supposed to make this from your own estrogens. But as you age and you make less estrogen, or if you've had a hysterectomy or you're on hormone blocking medications that block estrogen, you're not going to metabolize estrogen. You're not going to have that precursor parent molecule to begin with. But it's the final metabolite of estrogen. And I think you bought my 2-MeO course. And for years, doctors and scientists thought it was a nothing, that estrogen was broken down into this final nothing. It's just a little dud. It doesn't do a thing. It was so arrogant, right? Because would nature ever do anything not for a perfect reason?
Exactly.
You can't fool Mother Nature. I love that commercial. So it's true. And estrogen signal many things for life, but if they're in excess, they can put us at risk of cancers, because estradiol and estrone signals are growth signals, and cancer is growth out of control. So you don't want estrogen signaling excessively to promote growth out of control. So if you can healthfully metabolize estrogen down to that final, what used to be regarded as a dud, 2-methoxyestradiol, or the acronym is 2-MeO, that puts a brake on estrogen. It does all of the opposite things that nasty estrogen in an excessive state would be reined in by 2-MeO. So you make estrogen, and then if you properly break it down, you control estrogen. So 2-MeO is a controlling final metabolite. It actually was made into a drug called Panzem. It went through phase 1 and phase 2 NIH trials. It was given to women who had intractable breast and ovarian cancer, who had failed, I think to get into the studies, you had to have failed 3 interventions of chemotherapeutic interventions.
Wow.
And then they went on the 2-MeO, which was a synthetic version because it was in a patentable drug and it was oral. So that reduced its bioavailability quite a bit, and it also made the participants of the study nauseated, so compliance started to go down, but it did put people into very long remissions, people who had not responded to regular interventions. It's also been used, it's blocks blood flow to tumors, blocks proliferation of tumors, blocks carcinogenic cellular activity, mutagenic cellular activity, blocks inflammation. It's been used in certain trials to treat pro-inflammatory illnesses like rheumatoid arthritis. So it's a very powerful metabolite, and it's still being looked at aggressively, but because they made a synthetic version to patent it, and I was making a bioidentical version that I was taking inside my labia mucosally, not orally, I was getting a very different delivery mode than they were doing in those research, but they didn't continue it because of those issues with it, and they do have the patent on it. And I've been eyeing that patent, I've been like watching the patent office, because I really like to make sure that more of us have access to 2-MeO and understand it, and understand the other hormones that are protective against getting a primary tumor or a recurrence of the tumor you've already had, rather than the blanket statement that once you've had a hormonally driven cancer, such as breast cancer, you are never a candidate for hormones. That is old thinking that misunderstands the science. Now, this doesn't mean that every single woman is applicable, but it does mean this is not taught in med schools yet. If you ask your oncologist or gynecologist, 97% of the time, and I'm just throwing out that from what I hear from other patients, you're apt to get the wrong answer. They do not understand hormones. They're the most misunderstood genre of medicine.
So why is there this fear of hormones? I mean, people are told by their oncologists not even to use flaxseed because it's a plant estrogen. So
it's ignorance. You don't realize how ignorant doctors can be.
Yes,
I mean, they're
yes.
just just because they're smart and can answer tests and go through schools does not mean that they're a wise doctor. I'm sorry.
Right.
I'm so fed up with it. I have patients call me and say, my doctor found out I was on progesterone, and my endocrinologist, and he said to me, I'm surprised you don't have cancer yet. Well, it's the progestins in the Women's Health Initiative that were identified as increasing proliferation of pre-existing unknown breast cancer cells, not natural progesterone. In fact, in my book, Safe Hormones, Smart Women, I go through all the science and I show that bioidentical progesterone has never been linked with upping the risk of breast cancer. In fact, it either has had no effect on it, or it's actually reduced the occurrence of breast cancer. And it's so much ignorance. Ignorance in the hormone field is just rampant. I don't know why it's so, but because estrogen can cause growth signals, people just hear estrogen and they think everything that's estrogenic causes growth signals. So
Exactly.
I wrote Hormone Deception, and based on that book, I was invited to be a hormone scholar at an estrogen think tank at Tulane University Med School. So there, I had the honor, really the big honor that most your doctors that you sit and talk with don't have, of working with Elwood Jensen, who discovered estrogen receptor alpha, the first estrogen receptor, and Yanaki Gustafson, who discovered the second estrogen receptor beta. So first is the first letter of the Greek alphabet, the first one discovered. You could call it ER1, but it's ER alpha. Now, what this means is hormones deliver their signals by swimming into a set of proteins in the shape of a satellite dish. Wherever you have these satellite dishes, hormones deliver signals. Well, in the breast, as it turns out, there's lots of satellite dishes for the male hormone testosterone. And testosterone helps control growth. And the reason it helps control growth is it signals to the second estrogen receptor. There's about 10 or 12 that are identified so far. We don't even know what all of them do. We know mostly the first estrogen receptor, which is more of a growth signal, and people know that, so that's in their heads. But estrogen receptor beta, when that's signaled, it signals controlled growth. Testosterone, if it's well metabolized, actually signals that anti-cancer breast receptor. Estrogen receptor beta is an anti-cancer estrogen receptor. In fact, Yanaki Gustafson, in his very first article in 1996, where he introduced to the world the concept of ER beta being a second receptor for estrogen that does the opposite of ER alpha, it helps control growth. Right on the front, he had a picture of a balance. So, you know, the scales of balance.
Mm-hmm.
So if you have in local tissues, if you have the right amount of the aggressive estrogens compared to the right amount of the anti-cancer estrogens, your tissues will be safe. And there's ways of looking at how much testosterone you have versus the aggressive estrogens. There's all these ways of looking at ratios of hormones to make sure that your breast tissue, or in gents, prostate tissue, is safe. So,
so what is that? What's one way that if women who want to prevent or heal, reverse breast cancer, or they're behind the journey, what are some things that they can do so that they can take hormones safely? How do we measure? What are the best tests for that?
Well, if you want to measure, you have to do what I like to do is a 24-hour urine test that shows you your ratios of estriol, which is your anti-cancer estrogen, and it signals only estrogen receptor beta, your anti-cancer estrogen receptor. And it gives you a ratio called the estrogen quotient, comparing it to estrone and estradiol, and you want that ratio to be above 1.5. That's one way of looking at that. You also can look at your protective testosterone versus your aggressive estrogen. So for example, we know there was a salivary test published in the British Cancer Journal a number of years ago that took a look at levels of male hormone and female hormones in women who had breast cancer compared to women who didn't. And women who have breast cancer tend to be very low in male hormones because male hormones protect the breast cells from turning into breast cancer cells. So you can run a testosterone metabolite ratio blood study. It's a fasting blood study. And I'm going to be selling all of these kits now on my website, I think by the time that this launches, because I want to make this available for women. So if they don't even have to go see a doctor, they can just get this. If they want me to write a written interpretation of it, I will, if they want to see me as a patient. But if you just want to get it and work with your own team, you can get that right from me. And if you want to get a written assessment of it, I'll also make that available because I want women to know that they can do this. And my editor for my last 10 books had breast cancer over the last 10 years. And I had her edit my new free ebook, which I put all the science and describe all of this. You can hand this to your cancer doc. And she said, I have an appointment with my oncologist today, right when I finished the ebook last week. She said, I'm going to hand it to her today. So this morning, before I was coming on your interview, I emailed her and said, what did she say? And I asked her to run all these new molecules that we know drive cancer. So there's new molecules to run. And I asked her to run those. Well, the doctor never heard of any of those molecules.
Sure.
But she was really interested in the paper on testosterone and how it can be given to some breast cancer patients during chemo or right afterward. I've been working for 7 years at the Wiseman Family Practice Clinic. With the blessings of oncologists here in town, we're giving women, right after they finish breast cancer treatment, testosterone as pellets or a mucosal topical prescription, along with an aromatase inhibitor, so the testosterone won't go into estrogen. It'll stay as testosterone. It's the male hormone. It's testosterone and dehydroepiandrosterone, DHEA. The two male hormones protect breast cells not to turn into breast cancer cells. They protect you against a primary tumor, and if you've had breast cancer, if you have enough normal, healthy level, not too much, not too little, we all like hormones like Goldilocks levels, it helps prevent you getting it back again. In this research, which I present in this ebook, free ebook I want everybody to have, it shows how the combination of both of those made the tumor shrink by almost 3% a day.
Wow.
And made the patient much more responsive to the aromatase inhibitor than if they were only on the aromatase inhibitor by itself. Now, there are natural aromatase inhibitors, as you know, and I'm sure your tribe knows, but there's not been research on that. But this means that women can go through, if they do allopathic care, they could reduce chemo brain, they could reduce hormone insufficiency symptoms, they can get their energy back because the brain is filled with these receptor satellite dishes, and when testosterone signals, the breast cancer post-treatment patients that have that hormone on board sail through compared to the ones that are dragging their patooties from having no hormone function. You know, it's this old thought, hormones are scary, you have a hormone-driven illness, stop all your hormones.
Right.
And that makes you, it really enhances your aging and makes you feel like you're 100 years old.
Yeah. Yeah. So where could they find this ebook? Just by going to your website?
Right. I'm going to give it as a gift to your community, as a link to your gift.
Thank you so much. So yeah, we'll link this with the podcast, so it'll be there. And while we're talking,
I'm going to have it in my store, and it's going to be free. And then I'm going to have it as an opt-in. You know, you just come in, just give me your email and your name, and you can have it and pass it on, or give it to your cancer doc, or, you know, let's get the word out.
That's awesome. That's awesome. So you mentioned,
of course, there are natural things that up testosterone. It doesn't have to be a hormone.
Okay, so two questions then. So you mentioned natural aromatase inhibitors, and I get that question all the time. So what are your recommendations there?
Well, melatonin is in very high dosages, 20 milligrams. That's what we give to breast cancer patients just after they finish their integrative treatment, because I'm a proponent of integrative treatment. And melatonin also can be taken along with an aromatase inhibitor. If you're on a regular aromatase inhibitor, it reduces the risk of hepatic or liver complications. And it does a number of other mechanisms that act even more powerfully or synergistically with aromatase inhibitors. So a number of companies have been trying to make a drug where they combine an aromatase inhibitor with melatonin. You can just take melatonin. Some of my patients choose only to take melatonin. I had when I had breast cancer, I went to Keith Block, who's an integrative cancer doctor used to be in Evanston, Illinois. Now he's in Skokie. And he used to recommend only melatonin. But now, because of the litigious atmosphere that we have, he recommends aromatase inhibitors and melatonin, because he says he doesn't want to pay for a lawyer's swimming pool. But if I was going through breast cancer therapy, if I had breast cancer 25 or 26 years ago. It's so great when you can't even remember the exact year anymore, because it's so stressful.
Right.
It's behind you. And if I were going through that right now, I would go on an aromatase inhibitor and testosterone. I would
Okay.
do that like immediately.
Okay.
And there's only one case study in the literature that I present in that ebook of where they tried it on a woman going through chemo because they didn't know is it only to be used after treatment or during. So in that one case study, which really isn't enough, but in that one case study, the testosterone made the chemo work better,
Interesting.
more
Interesting.
effectively.
So what are some natural ways to build up your testosterone?
So every time you make love, you make more testosterone in both men and women. So up with making love.
Okay.
There was a study at Georgia University where they took a look at 12 heterosexual couples and they measured their testosterone before and after lovemaking. And every night that couples made love, they made more testosterone. The nights that they didn't make love, the testosterone levels actually went down. They didn't stay level, they went down. Hugging releases a little bit of testosterone, but there are nutraceuticals that you can do. So coconut oil and olive oil both have been shown to increase levels of testosterone and make it metabolize to 3-beta adiol, which signals the anti-cancer estrogen receptor beta. So olive oil is fantastic. I would do a lot of olive oil and coconut oil if you're not reactive to coconut. I happen to be one of the few people on the planet reactive to coconut, so I do mainly olive oil. There's also nutraceuticals like zinc and magnesium and exercise. We know that men and women that exercise have better testosterone levels, but if you've had a total hysterectomy, you're not going to probably make that much. You're going to probably have to take replacement because you're losing out on a lot of the organs that help you make it. Also, thyroid function has a lot to do with testosterone. The free T3, liiodothyronine, which is the active T3, the thyroid signal that signals thyroid receptors, it helps nudge testosterone into its receptor. So there's a lot of promiscuity and familial support amongst all the nuclear receptors of the sex steroid hormone family, and also some ancillary hormones. So when I assess a patient's hormones, and unfortunately this is not done now in most gynecologic offices or endocrinology offices, I look at all the hormones because they influence each other. The cortisol, the insulin, the aldosterone, the oxytocin, the growth hormone, the multiple estrogens, multiple testosterone, the active and storage form of DHEA. All of these hormones, you could have hormones that look great, but you don't get the response or health that you should have. And it could be because another hormone you don't know about is tanked. And the other thing is the level of hormones. That's all we do now is test levels, whether it's blood, saliva, urine, we just test it. It's bogus. That's not functional medicine. Like, is where the rubber meets the road of hormones is at the receptor. Can whatever hormone you have nestle on into the receptor and deliver its email to the gene? Well, this receptor is like a bowl, and all your digestible food choices have to fill this bowl with specific nutrients that affects the duration and the health of the signals, your thyroid function, your iodine levels, your magnesium levels, your B vitamin levels. This is where the food works to help your hormones run your body. And if these are filled with competitive pollutants, then the hormone can't even get in, even if you have nutrients in there. So detox needs to be done in our dirty world today to clean these receptors out. So whatever hormone you have. So just measuring the level is a false sense of how your hormones are working, because it's not the functionality of them.
Maybe they're not bioavailable is what you're saying.
Right.
Right
Well,
there.
because a hormone only works as well as its receptor is functioning. And we have no test for that right now. In academia, we do, but in clinical arenas, we don't. So that's mainly symptoms. But in today's medicine, the laboratory trumps the symptoms. And in the old naturopathic and new functional medicine version, we treat the patient more than the laboratory. But many physicians out there are not trained in that to do so, and they will say your testosterone levels are way at the bottom, but they're still within normal. You're totally fine, when it might not be optimal for you.
Exactly. Excellent. Well, Dr. Lindsey, you're an encyclopedia and wealth of information. I could talk to you and listen to you all day.
I
So
hope I didn't talk too much. I wanted to, Vulcan mind meld a bunch of this information. I hope it wasn't too much.
no, no, it's so informational, and it's so important that women understand. And I preach this all the time. Your hormones do not cause cancer. Don't fear your hormones. You need your hormones for every function of your body. And I'm so glad that you can emphasize that and help us and help our community to understand that you don't need to fear your hormones. And bioidentical hormone replacement can be beneficial if you do it in conjunction with somebody who oversees the work and understands the work. So it's very, very important to measure and test and know exactly where you are with everything. So thank you so much. And thank you for the ebook that you're going to be offering. I can't wait to get my hands on it and share it with the community as well. So thanks for your time.
And just so you know, I do a whole entire show on my radio show, Dr. Berkson's Best Health Radio. My most recent radio show is all the science, where you can listen to this while you're driving to hear this whole topic of testosterone and breast cancer survivors. And I go into the science and the mechanism. And then I've got the ebook that has the whole thing written up.
And so what's your website, Dr.
My
Lindsey?
website is Dr. Lindsey Berkson, DrLindseyBerkson.com. And I'm launching a membership site in just a very short while where people can hang out with me and ask Q&A of all the recent what's going on in health, hormones, and nutrition. And then I'll also have a membership for professionals where we'll go over patient cases and a lot of the in-depth science. So I'm starting that very, very soon, and that'll all be on my website.
Awesome. Okay. Well, thank you for all that you do in helping us to keep healthy and strong and create that vibrant life that we all look for.
Thank you for having forums like this. This is where a lot of people get educated. Bless you.
Oh, thank you.